All right, increasingly the world is paying attention to mental health, and in many Western countries, death due to suicide is no longer a crime. Now, the respective laws were changed in those countries in an effort to manage and prevent suicide cases. But right here in the country, in Kenya, and Africa generally, in particular in Kenya, death due to suicide is still a criminal offense, punishable by law. Now, mental health advocates have been on the forefront championing the decriminalization of suicide. However, their efforts are yet to bear fruit. KTN's Health and Science reporter Sada Hassan tells us more in this special coverage of mental health.
In June 2019, President Uhuru Kenyatta acknowledged the burden of mental health in the country and the need to set measures to handle the situation before it gets out of hand.
I urge employers and institutions of learning to invest more time and resources in monitoring and facilitating the mental well-being of their charges. And I therefore direct the Ministry of Health in consultation with county governments, the Ministry of Education, Labor and Social Protection and Public Service, Youth and Gender Affairs, to formulate an appropriate policy response.
2 years down the line, policies have been proposed, written and presented before legislatures, but not much has changed within the mental health landscape. The COVID-19 pandemic brought to life the real picture of what happens behind closed doors in many Kenyan households. Data compiled by the Department of Operations at DCI between April and June 2021 shows that Central Kenya leads with 181 suicide cases. Rift Valley follows with 68 suicide cases, while Nyanza closes the top 3 list with 67 cases. Nairobi, Eastern, Western and Coast regions are also not doing so well. On the flip side, Northeastern recorded the least number of these cases with only 3 people taking their lives. In the counties, Kiambu County leads with 109 cases. Murang'a follows with 37 cases, the top list with Kisii 25 cases. Other counties like Kakamega, Nyeri, Kisumu, Embu, Uasin Gishu recorded high number of suicide cases, just like Nakuru, Makueni and Bomet, which recorded 17 cases each. Counties that recorded below 17 cases include Kericho, Nyandarua, Machakos, Migori, Narok, Meru, but Mombasa, Busia, Laikipia, Taita Taveta and Wajir each registered below 5 cases. But there are some counties that did not register even a single case of people ending their lives. According to mental health advocates and legal experts, countries need to decriminalize suicide as a way of reducing, if not ending it completely. Victor Kamau, who is the Deputy Director of Kenya National Commission on Human Rights, says there is a lot of pressure that is contributing to rising stress levels, hence the option to commit suicide.
It is very important because the world is at the moment struggling and reeling and rocking under the impact of a multiplicity of problems which really cause a lot of severe stress and that are leading to a lot of either suicides or attempted suicides. And there is a general need for the world to remember that we need to help those people who are under severe stress by referring them for medical help and also counseling and psychosocial support.
So what does the law say about suicide?
Law right now as it is, Section 226 of the Penal Code stipulates that any person who tries to kill himself, any person who attempts to kill himself is guilty of a misdemeanor and is liable to imprisonment or a fine or both.
According to the World Health Organization, a life is lost through suicide every 40 seconds globally. This is similar to 2,160 people dying in a day. Cumulatively, this means that almost 65,000 people take their lives every month and over 700,000 annually. Report published in 2021 by the United for Global Mental Health program shows that even though most countries have decriminalized suicide, 20 countries are still stuck with some laws dating as far back as 160 years, which criminalize suicide. Statistics show that over 79% of suicides occur in low and middle-income countries. However, due to the stigma surrounding suicide, the cases are often underreported.
We have not handled any cases of persons being punished or prosecuted for attempting to commit suicide. But we have, of course, studied many cases, and we know that there have been instances in Kenya when people have been sentenced to prison for attempting suicide. I will also add that actually the criminal courts are very reluctant to punish people for attempted suicide. They instead choose to refer them for medical help.
Some concerned members of our communities may urge those who attempt suicide to stay strong and keep going. But in most cases, silence and condemnation greet those who attempt to take their lives. According to experts, the law that criminalizes suicide represents our attitudes and perceptions towards this mental illness. Saada Hassan, KTN News.
Mental health, very important, and